West Yorkshire, home to nearly 2.5 million people, 70% of which have experienced a traumatic event during their lifetime. In this mini-series, we'll be taking a deep dive into the West Yorkshire Adversity, Trauma and Resilience programme, jointly delivered by the West Yorkshire Health and Care Partnership and the West Yorkshire Violence Reduction Partnership. The programme aims to prevent harm and improve the well-being of the population. The West Yorkshire ATR partners are reflecting on their goals and ambitions for the programme.
My aspiration for Kirklees would be that the whole of our practice is trauma-informed. And I appreciate that feels a bit like a soundbite because clearly that's going to be difficult to do. So given the constraints that we're in financially as a system and obviously given the cost of living crisis for our residents, I think for me it's making sure that the things that are going to have the most difference are prioritised.
Well, I think we've still got a long way to go to be a trauma-informed system, and I would say I'm really looking forward to us using the maturity matrix to get a real sense of where are we, where are the gaps, what more can we do, and to prioritise the things that we need to do to get a really comprehensive sort of systems-based approach to that. And I can see that we can really point to some very specific benefits, as Niamh said, of taking a trauma-informed approach. But I'd really like more people to be able to be benefiting it, to have an impact on outcomes from a greater number of people.
Going out across the system into other bits of the service, particularly our criminal justice partners, that we could do so much better without using the criminal justice system with this approach. But also for me, and I live here as well, so it is very important, it's a bigger community response than just the services. So I'd like people to feel safer by looking through a trauma-informed lens, because I really believe they could.
The aspirations for WDH to be trauma-informed, there's probably three different things that I'd be looking for. One is that in all our meetings that we would see that people are talking about trauma-led practice. So we'd see it in all our higher level meetings and in all the team meetings that people carry out. The second thing that I'd like to see is that reflective practice and restorative supervision is the approach that we take, not just with regards to tenants, but also with regards to how employees speak to each other.
It will really improve our team's well-being, and I think it will improve the services that we deliver to our customers, and hopefully it will give more positive outcomes with the interactions that we have with our customers.
And the third thing I'll be looking for is that we have trauma-led champions throughout the organisation, so that it's not just a one hit, but we continue on our journey to being trauma-led for many years to come.
I'm really enthusiastic about it and I love it, and I want to be one of the champions, so hopefully.
What we want for Leeds is for everybody who works with children, young people and families to realise that they have a part to play in helping children and young people who've experienced adversity and for whom that's had a traumatic impact in their lives. Not by becoming counsellors or therapists, but just through their everyday interactions, having that sensitivity, that awareness, that compassion for what's gone on in somebody's life, what's going on, and being curious about how they can understand any behaviours, any troubles that that person's having through thinking about that.
So in Wakefield, we're really committed to continuing our trauma-informed journey. We've recently delivered a workshop where we've brought together practitioners from adults and children's services to share their really good practice. We're developing a website that will be a repository for all of our resources. Our voluntary and community sector are really engaged in this journey and have some real sort of strength of practice that we can start to really pull into our overall approach to becoming a truly trauma-informed place to work, but also to live. And ultimately, I think our aspiration is that whatever service you turn to in Wakefield, you feel that have confidence that that service will be practising in a trauma-informed way.
We're aware that trauma absolutely impacts people's behaviour, but also their mental health and physical health. And we want to ensure as a service that we are not contributing to that by making them go through assessments after assessments and retelling that story that has clearly had a massive impact on them.
Personally, I want to make sure that we keep this conversation on every agenda And we've been able to demonstrate that anecdotally over the last 3 years. So we see trauma-informed, we see adversity trauma resilience referenced in strategies. People are talking about it, still talking about it. And that, I think, will always be an aspiration for me, as in what we should always kind of keep at the forefront of our mind, that this is everyone's business. It's not just us in public health or colleagues at Stat Bradford. It's a whole system piece of work. So everybody from front of house straight through to our decision makers and those that hold the purse strings need to be trauma informed and aware of it here.
We've heard the aspirations of some of the partner organisations, but how will they know if they've been achieved?
We prefer to think about it as not an end destination, but as a process and a journey, and that we're always going to be on that journey. And the journey is to kind of seek to be compassionate and keep people safe and avoid re-traumatisation in everything that we do.
Well, the work is never over, especially in the emergency department. We have such a high turnover of staff, and there's always new ways that we can improve our service to become more trauma-informed.
The work that we're doing together will help the people of West Yorkshire because it will speak to their lived experience, it will speak to their reality, which is that we all experience hardship in whatever form that comes. We all experience trauma, and we respond to that trauma in a different way to each other. And if the work that we're doing to bring about this revolution of a trauma-informed West Yorkshire, if that works, then people in West Yorkshire will know that their lived experience, their difference, their individuality and uniqueness, which we love and we want to preserve, that will be taken into account by every service, every bit of the system that they come into contact with, and that the service will be personalised to them and to their needs.
Kids getting the best possible start of life in loving situations where they're well cared for and able to develop as we'd expect any child to have normal childhood experiences and feel secure in a family or other settings. That means that they then, all the milestones that we would expect a child to hit, they can hit. And actually, for me, it's about them ultimately emerging into adulthood, brimful of confidence, optimism and skills to navigate adult life.
Over the last 4 years, the programme's partners have been influential in all sectors across West Yorkshire. Let's hear about the impact they've been having.
We've been working hard across our system to make sure we're trauma-informed, and I think there's some great examples around ensuring co-production's built into everything that we're doing when we're setting up a new service or we're needing to transform it, and bringing and working with people with lived experience into that design and that decision making I think is incredibly important, and I'm trying to do that myself as Chair of NHS West Yorkshire in bringing that lived experience into our senior level decision making.
We want to be a service that asks the questions, what happened to you, rather than what is wrong with you.
When I got picked up by Anne-Marie, I mean, I was a DV perpetrator, and I was floundering. It cost me my marriage temporarily and stuff, and I just didn't know what to do with myself and stuff. And when I got Anne-Marie as a support worker, she was great. She literally helped me out. She fielded phone calls for me and stuff like that until I felt I was capable of actually proceeding on my own. As you know, I suffer with anxiety, severe anxiety, which I self-medicated for years. So I was drowning, and Anne-Marie was extremely patient. You know what I mean? And even because of the nature of my journey through L&D, you know what I mean? There was never any judgment there. You know what I mean? It was all done at my own pace. You know what I mean? Until she felt I was capable.
The senior leadership buy-in that we have is really making a difference, because they are right behind us in terms of our mission to have everybody in the organisation aware of what trauma-informed care is and that it's everybody's business. And they've also supported us in promoting our trauma-informed care badge, which symbolises some of the key features of our programme.
I'd like to think that we've made a really positive impact on the lives of vulnerable people attending our emergency departments at CHFT. I also think that we've made a really positive impact on our colleagues and our workforce in their confidence and how they respond to complex safeguarding issues.
That's all for part 3, looking at the West Yorkshire Adversity, Trauma and Resilience programme. In our final part of this mini-series, we'll hear how the programme plans to keep the momentum going.